About 5.7 million adults in the United States have heart failure. Approximately 50% of those adults will die within just 5 years of receiving that diagnosis. The 3 to 6 month readmission rate has been reported to range from 30% to as high as 50%. Elderly patients with heart failure are also at increased risk for early rehospitalization, with rates of readmission ranging from 29 to 47% within 3 to 6 months of the initial discharge.
Hello, Miss Garcia. All right, so I've got your discharge orders. I'm just going to do one last listen, and the nurse will do all the planning for you. Okay. Are you feeling better?
Yes.
Oh, good. Perfect. Okay. Yeah, I got all your medications in there, and she's just going to get you ready to go. Okay? Thanks.
Is she good to go?
Yep, good to go. I've got the next patient that needs to come in the bed, so we need to hurry and get her out of here.
I'm gonna go. Here's about 2 pages educating you on your CHF. When you get home, you need to set up an appointment with your PCP. I also have all of your medications. Looks like you have quite a few here that are all being sent to your pharmacy. Here is a list of those. All your medications are on there with what they do and how they work and stuff. So we have transport here with a wheelchair, so we'll get you going here, get you home. Do you have someone picking you?
Hi, Miss Garcia. I wasn't expecting to see you again so soon. What brings you back?
I can't breathe.
You can't breathe. What about your medications?
I didn't pick them up.
You didn't pick them up? Okay. Well, let me just take a quick listen then.
What went wrong? Patient was readmitted in 1 month. Nurse did not educate. Nurse was rushed. Doctor was rushed. Doctor was on her phone. No ride home provided. We start with the initial diagnosis, the admission of the patient. Then we develop an assessment and care plan. We call the provider to get orders. We then give meds, reassess the patient, analyze if our goals were met, and we discharge the patient, following a very high rate of readmission. 3 lean methods were used to analyze the problem: 5 whys, brainstorming, the fishbone diagram. CHF patients have longer length of stay than expected or frequent readmission. Why is this happening? Patient has exacerbation of HF symptoms. Why is this happening? Patient didn't take his medications. Why? Patient didn't know which medications to take. Why? The nurse didn't educate patients about the medications. Why? The nurse didn't have a teaching plan. The next step is to brainstorm the problem. The problem itself being the high rate of readmission of the CHF patients. Gathering your team members, including the RNs, doctors, pharmacists, case manager. Engage in a 10 to 20 minute meeting in which each member rotates and gives ideas of how they think this problem can be solved. For a proper brainstorming session to be effective, there are certain rules which must be followed, such as no criticism. A person is allowed to say pass if they don't have an idea that they think is helpful. The quantity of ideas is the goal, and any idea is welcome. Suggested interventions would be teach-back methods, medication education, follow-up appointments, and case management. Any ideas which revolve around these interventions and which would lead to addressing the problem of high readmission are welcome. The fishbone diagram functions in the same way that the 5 whys did before. It seeks to find what was the cause of the breakdown in treatment and how can we address that cause moving forward. The fishbone diagram gives us a visual way to track each cause, why each cause happened, and how we can address that cause moving forward. Next, we see a flowchart which centers around a care plan designed to lower readmission rates of CHF patients. First, we have the CHF patient admission. We then enter into our assessment and care plan development. Call provider to get the orders, at which point we deliver the meds, reassess patients, and decide whether or not we have met our goal. At this point, we begin the discharge process, but in between the beginning of that process and the eventual discharge, we teach about CHF diet and lifestyle changes. We teach back with the patient. We consult the pharmacist for medication education so that we can involve the family in the case management. Determine the patient needs after discharge. Ask the patient if they have any questions. Then and only then, if they say no, do we discharge. If they still have questions, that means that they have a higher rate of readmission down the line, and that means that we need to continue with our teaching plan.
Hi, Miss Garcia. How are you doing?
I'm good.
You're doing okay? Are you feeling better?
Yes, I feel much better.
Good, good. And who is this that you have with you?
I'm her sister.
You're her sister, okay? Is it okay if I go over, I'm about to go over your discharge information. Is that okay to go over in front of her?
Sure.
Okay. So the doctor put you up for discharge. I'm just going to do a quick assessment of you and check, make sure you sound okay and get some vital signs. And then we'll sit down and go over your discharge instructions, okay?
Okay.
Alright, I'm going to go ahead and talk about sort of like some education that we can kind of decrease confusion going home for you, okay? So, just specific to heart failure, you should know that you should be exercising as much as you can tolerate with your breathing. So like any kind of light walking, any swimming, anything like that will help you to improve your cardiovascular output. Your diet, you want to just basically stay away from any salt. So even if you go out to eat, remove the salt from the table so that you're not tempted to grab it and put on your food. You can season with herbs and like oils and things like that. That will be good. Don't smoke. If you do, we can set you up with a plan to quit. Obviously your medicine, has the pharmacist come in and talk to you about your medicine?
Yes.
Okay, good.
Yes,
So you
they
don't
do.
have any questions about any of that?
No.
Okay, good. But you know who to contact if you do?
Yes.
Okay. Weight monitoring, so you know that if you have a significant amount of weight, so 2 to 3 pounds within 2 to 3 days, to call your healthcare provider. Okay, we just want to make sure that you're monitoring your weight every day at the same time. If you have shortness of breath, trouble breathing at night, especially when you lie down, swelling in the legs, feet, or belly, become easily fatigued, rapid or irregular heartbeat, weakness or lightheaded, or swelling in your neck veins, make sure you give us a call, okay? We are implementing a new plan for heart failure, and so I'm just going to go over what that's going to look like for you when you get discharged today.
Okay.
So you'll be discharged today, and then in a week we want you to come to your doctor's office, and we will then talk about the treatment plan, how's it going, your medications, if you have any questions. You're going to teach back to us what you've been doing so that we know that you've been doing what you're supposed to be doing. And obviously we want you to bring your family to this appointment as well. And then you're going to make sure that the doctor gives you everything that you need. So any kind of prescriptions that you need for medications, any refills, making sure that that's all good to go. We'll also keep an eye on that, but we want you to be in on that too.
Okay.
And then after a week, we're going to have every 2 months you come to an appointment, okay? And at this time, you're going to verbalize any concerns that you have, any confusion in the treatment regimen, anything that we need to change if something's not working. And then also, at every 2 months, we're going to draw your labs. So specifically going to be watching that BNP level, okay?
Okay.
And then every 6 months, we're going to have you come in for an echo just to monitor your heart failure progression, okay? Does that sound okay?
Yeah, sounds good.
Do you have any questions for me?
No, I got everything.
Okay, good. Well, we
Education was a huge factor in lowering readmission rates among patients with CHF. Due to this, the primary focus must be ensuring that the patient and their family understand their treatment before discharge. A sample teaching plan would be as follows. Patient educated at discharge from hospital with family present. Patient will verbalize education back to nurse to ensure education is understood. Patient will follow up with healthcare provider 1 week following discharge. At this appointment, patient and family will verbalize to the healthcare provider any concerns in the treatment regimen and any questions they may have. Patient and family will follow up every 2 months with healthcare provider. Patient and family will verbalize any concerns in the treatment regimen and any further questions they may have. Healthcare provider will ask questions related to congestive heart failure. Go over importance of daily weight. Have patient write down daily weights in a journal and bring each to appointment. Patient will know to report to healthcare provider's office with a weight gain of 2 pounds in 2 days or 5 pounds in 5 days. Patient and family will talk about nutrition with the healthcare provider. Certain aspects of this nutrition will focus on reducing salt in diet, choosing plenty of fresh fruits and vegetables. Season with herbs, spices, herbed vinegar, and fruit juices. Read food labels before buying packaged foods. Labs will be drawn, specifically BNP levels. Every 6 months, patient will have an echocardiogram to monitor heart failure progression.
3 Utah hospitals are among the top in the nation when it comes to keeping heart failure patients healthy and out of the hospital. Intermountain Medical Center Heart Institute in Murray is one of those hospitals. Here to explain how they're accomplishing this is Kismet Rasmussen, a nurse practitioner with Intermountain Medical Center Heart Institute. And so when someone leaves, it's almost a little bit of a panic because you don't have the doctors and the nurses and everyone coming to check up on you. But you really want those heart failure patients to take advantage and take control of their own health. What do you teach them? What do they do after they leave the hospital?
You know, it's such an important aspect of heart failure care and chronic illness care is for patients to understand their illness and engage in self-care. So we teach patients in the hospital how to do that, how to use a diary to monitor their weights and their symptoms. And then we really want them to do that in the outpatient setting so that they know when they're running into trouble so that they can call their care provider early before they run into trouble where they might need to be readmitted in the hospital. So it really is a partnership with their care team so that they know when they're stable and then when they should call if things start to change for them. So we're trying to focus on all heart failure patients, but especially those that are at the highest risk of having a readmission. We're focusing with a very concerted effort with a multidisciplinary team, the providers, the nurses, the pharmacists, the dietitians, cardiac rehab staff, to really educate patients and enhance their services when they're in the hospital. And then once they're in the community, in their own home setting, we provide a follow-up call for them within 3 days of discharge. And then we have a follow-up scheduled appointment within a week of discharge so that they get that close follow-up to see that they're following the plan at home and to see if things are changing and how things can be adjusted to keep them stable.
And so this has to be a whole partnership of a lot of people making sure, including the patient, making sure that they are healthy in the future. Registered nurse Kismet Rasmussen, thank you for joining us.
Thank you.
To ensure that our plan is effective in maintaining our patient's heart failure, the following criteria will be addressed at each follow-up appointment. BNP levels will be the same or not to have exceeded 10 points above that patient's baseline level. Any rise higher than 10 points above the baseline will be scheduled for an outpatient echocardiogram. Troponin levels will signify a level around baseline. Any rise of 0.03 above troponin baseline will be scheduled for an outpatient echocardiogram. Patient will report a decrease in symptoms of worsening heart failure immediately. Cough, difficulty breathing, weight gain of more than 2 pounds in a day or more than 4 pounds in a week, and or a significant increase of edema. Patient will provide a weekly and daily weight log and will make an appointment if weight exceeds the 4 pounds in a week. Patient is tolerating light exercise, such as a walk for at least 20 minutes a day. Patient will bring said food diary to each appointment, and healthcare provider will look at patient diet and make necessary recommendations. In conclusion, significant strides have been made in the reduction of readmission of chronic heart failure patients. However, there are areas for improvement, specifically in educating patients and their families. The amount of information given to a patient with CHF at discharge is daunting, and it is nearly impossible for the patient and family to remember everything that they should know to maintain or to slow the progression of heart failure. We believe that this cohesive plan detailing important information not only at discharge, but also in every planned appointment thereafter, can significantly reduce readmission of these patients. In this plan, at each appointment with the healthcare provider and family, the following items will be discussed: medication regimen, diet, nutrition, follow-up appointments, and having clear communication and expectations between patient, family, and healthcare provider. The patient will have the opportunity to ask questions and voice concerns, and the provider will be able to encourage the patient and family to teach back the instructions given to them, in this way ensuring that everyone is on the same page and that they are going forward towards a cohesive goal.